Welcome to part 3 of the CO-50 Masterclass. This is where most clinics lose money. You have a patient who comes in for their annual physical. The doctor orders a vitamin D test. You bill the physical with diagnosis Z00.00, encounter for general exam. You bill the vitamin D test 82306 and link it to the same Z code. Boom. Denial CO-50. Medicare does not pay for screening vitamin D. They only pay for diagnostic vitamin D. So, how do you fix this? The answer is in the chart notes. If the patient has no symptoms, you cannot bill it. You have to write it off or bill the patient if they signed an ABN. But, if the doctor documented fatigue or muscle weakness or bone pain, you have a covered diagnosis. You do not appeal this. You submit a corrected claim. Change the diagnosis pointer for the lab test to point to or 53.83, fatigue, instead of the physical. Suddenly, the preventive test becomes medical, and the claim gets paid. Now, let's look at the high-dollar scenario, the colonoscopy. This is the most common cause of CO-50 confusion. A patient comes in for a routine screening, Z12.11. Medicare covers this 100%. No deductible. No copay. But during the procedure, the doctor finds a polyp and removes it. The procedure has now changed from screening to diagnostic. If you bill it wrong, the patient gets hit with a surprise bill, and they will call you screaming. To fix this, you need the conversion modifiers. These modifiers tell the insurance, this started as a screening, but we found a problem. For commercial payers, like Blue Cross or UHC, add modifier 33 to the surgery code. For Medicare, you must use modifier PT. This tells Medicare to waive the deductible even though it was a surgery. If you forget the modifier, the system assumes it was a planned surgery, and the CO-50 logic might kick in or the deductible will apply. Here is the pro tip that fixes the denial. Even though you removed a polyp, you must keep the screening diagnosis, Z12.11, as the primary diagnosis in box 21. List the polyp, K63.5, as secondary. Why? Because the intent of the visit was screening. If you remove the Z code, the computer thinks you are billing a diagnostic surgery without a prior symptom, and it might flag it for medical necessity audits. And here is a specific update for 2026 that you need to tell your patients. When you use modifier PT for Medicare, the deductible is $0. However, the coinsurance is not $0. For 2026, the patient is responsible for 15% of the allowable amount. It used to be 20%. It is phasing down to 0% by the year 2030. But right now? They will get a bill for that 15%. Don't tell them it's free. Tell them the deductible is waived. So, let's recap part 3. First, never link a diagnostic lab, like VitD, to a Z code unless you want a denial. Find the symptom. Second, if a screening turns into a surgery, use modifier PT or 33. Third, keep the screening Z code in the primary position. You have now survived the CO-50 Masterclass. We covered non-covered services, linkage errors, and the preventive trap. If you apply these rules, you will recover thousands of dollars in revenue this month alone. Make sure to subscribe. Next week, we are tackling the excludes one note, the silent killer of claims. I'll see you there.